Hello and welcome to this recording that's looking at building rapport in education, trauma-informed approaches to student success. My name's Janet King and I'm the Sector Manager for Education and Early Years, and I'm joined here by Gemma McGregor, who is our Provider Development Officer. In this session, we'll delve into techniques for fostering supportive relationships, de-escalating conflict, and addressing the complex dynamics of interpersonal interactions. You will gain insights into key principles of rapport building with a focus on understanding and managing transference, countertransference, and emotional triggers to create a more inclusive and empathetic learning environment. We hope this session supports you to better support all students on their educational journey. Let's begin by considering neurodivergence. Neurodiversity refers to the difference between how people think, process information, behave and communicate. And some forms of neurodivergence include attention deficit hyperactivity disorder, autism, dysgraphia, dyscalculia and dyslexia, and Tourette's syndrome. Some neurodivergent people may have more than one diagnosis. Others may not have any diagnosis at all. It emphasizes that everyone's mind works differently. People have different interests, motivations, skills, and strengths. These differences should be recognized, understood, respected, and celebrated. Whilst everyone is unique, most people are neurotypical. Their brains process information in a relatively similar way. People who process information differently may be neurodivergent. Neurodivergence refers to differences in mental or neurological function from what is considered typical. This results from a difference in the way the brain develops before birth and during childhood and affects how someone communicates, behaves, and responds to the world around them. It's estimated that 15 to 20% of children and young people in the UK are neurodivergent. When considered in the context of neurodiversity, neurodivergence does not necessarily describe a disorder, deficit, or disability, but simply a different way of thinking and learning. Like anyone else, neurodivergent individuals will have their own individual skills and strengths, which should be encouraged and developed. Whilst some may need extra support, all learners can benefit from a greater awareness of neurodiversity and more inclusive environments and attitudes. It's important to note that neurodiversity does not refer to a mental health condition. Likewise, neurodivergent individuals do not necessarily have poor mental health. However, due to social expectations and a lack of support and understanding, neurodivergent learners may be particularly susceptible to mental health problems, especially in environments where differences are not understood and respected. Educational settings can be an anxiety-provoking environment for neurodivergent children and young people. Many learners can face cognitive, sensory and social challenges in the school or learning environment, which is usually designed primarily with neurotypical pupils and staff in mind. This can lead to masking, as neurodivergent learners feel as though they need to suppress natural behaviours and conform to social norms. Masking can be exhausting and lead to increased anxiety and periods of cyclic burnout. For example, parents may tell you that their child absolutely releases so much emotion, unsuppressed emotion, when they come home from school, and it can lead to quite difficult situations in the home environment. And what about staff? Neurodivergent staff may need particular support. Speak to staff to consider the best way to support them. If we think about it, every classroom is neurodiverse, isn't it? Every learner will have a different way of thinking, feeling and learning, and that needs to be encouraged and supported. While some neurodivergent learners might need specialist support, many will benefit from changes to their environment and better understanding and support from their peers and from staff. Fellow neurodivergent learners need to feel safe and able to act authentically. Work with individuals to meet their specific needs and build on their strengths. This might include creating individual learning plans. Consider the environment and carry out a sensory audit of the environment. Try to give all learners the option to work in a quiet area if they prefer. Use visual aids and other communication devices to support learning and communication differences. Gather student voice on neurodiversity and neurodivergence. Create opportunities to listen to neurodivergent learners and staff and use this feedback to reflect on the culture, the environment, the policies to ensure they are inclusive. Teach learners about neurodiversity. Use routine opportunities such as large group assemblies, tutorials, RSHE and so on to educate about neurodiversity and different kinds of neurodivergence such as autism. Advocate for increased awareness of neurodiversity and adopt a whole school or college approach to neurodiversity and mental health. Examples of neurodivergence may include dyslexia, dysgraphia, dyscalculia, and Tourette's syndrome. I am going to make sure that I share with you a case study that was written by a colleague of mine working with a classroom where there were ADHD learners. I'm going to make sure you have that and you can read and reflect on that in your own time. If we go through some of these different aspects now, I think I'll actually start with Tourette's. So often associated with ADHD, Tourette's syndrome is a condition that causes a person to make involuntary sounds and movements called tics. It usually starts during childhood, 2 to 6 years predominantly, and the tics and other symptoms usually improve over time. They can even go away completely. There's no cure, but treatment can help to manage symptoms. People with Tourette's syndrome may also have obsessive compulsive disorder, OCD, attention deficit hyperactivity disorder, ADHD, or learning difficulties. Tics are the main symptom and may include physical movements such as blinking, eye rolling, grimacing, shoulder shrugging, jerking of the head or limbs, jumping, twirling, or touching objects and other people. Vocally, grunting, throat clearing, whistling, coughing, tongue clicking, animal sounds, random words and phrases, repeating a sound, word or phrase. Swearing is rare, affecting about 1 in 10 people with Tourette's syndrome. Tics are not usually harmful to an individual's overall health, but jerking of the head can be painful, and this may also increase during periods of stress, anxiety, and tiredness. People with Tourette's syndrome can have mood and behavioural problems such as ADHD, OCD, depression or anxiety. They may also be at risk of bullying because their tics might single them out. Most people with Tourette's will experience a strong urge before a tic, a little bit like we might have before we sneeze. These feelings can include a burning in the eyes before blinking, a dry or sore throat before grunting, an itchy joint or muscle before jerking. Some can control their tics for a short while in certain social situations, such as the classroom. It requires concentration and can be tiring and may lead to a sudden release of tics after school or college. There's an absolutely wonderful NHS video and you'll see the link to that. You'll find the link to that at the end of the presentation. Moving on now to autism, and we can see this on this current slide. Young autistic people, just like their autistic peers, can have many varied strengths, skills and aspirations. We need to move away from disproportionately focusing on what learners can't do and instead give attention to what they are capable of. Some may include outstanding reading abilities, passionate interests, logical thinking, and hard working when motivated. Autistic differences are generally associated with sensory experience, communication, behaviour and interests. Thinking about how these differences are perceived plays a big role in how autistic children experience the world. Societal judgment can cause isolation and anxiety for many autistic people. Understanding and acceptance allows autistic children to feel a sense of belonging, which can enable them to achieve their goals. The Equality Act 2010 requires schools to make reasonable adjustments, and this requires effective partnership working. Where adjustments are not made, some learners may mask their differences, whilst others might experience visible distress during the school or college day. It is vital that we work closely with learners, families and professionals to understand differences and provide staff with any training that they need. Many parents agonise over school or college as they are concerned about bullying and their child's well-being. True inclusion means offering a sense of belonging in a safe and accepting environment. Use inclusive teaching strategies to access learning with any required adaptation and accommodation. Excellent communication with families and provide that training. Consider policy, especially behavioural policies, to ensure autistic learners are not at an increased risk of exclusion, and have frequent conversations with neurodivergent learners. Things are moving in the right direction, but we must continue to improve everyday experiences for our autistic learners. Let's move on now to think about adverse childhood experiences. The experiences we have early in our lives, particularly early childhood, have a huge impact on how we grow and develop our physical and mental health, our thoughts, our feelings, and of course how we behave. Two important factors to think about when considering mental well-being are the quality of our attachment relationships and our experience of adverse childhood experience. There's a little quote here from Young Minds that gives a definition of an ACE. Highly stressful and potentially traumatic events or situations that occur during childhood and/or adolescence. They can be a single event or prolonged threats to and breaches of the young person's safety, security, trust, or bodily integrity. Examples of ACEs include physical or sexual abuse, emotional abuse, living with someone who abused drugs or abused alcohol, exposure to domestic violence, living with someone who has gone to prison, living with someone with serious mental illness, losing a parent through divorce, death, or abandonment. In a 2014 survey by Bellis et al., a UK study on ACEs reported 47% of people experienced at least one ACE, with 9% having 4 or more. Just like attachment, experiencing ACEs can have an impact on our future physical and mental health, and can for many be a barrier to healthy attachment relationships forming for some. Some of the effects of ACEs on our physical and mental health are an increase in health problems, an increase of mental health difficulty, violence, and becoming a victim of violence. 1 in 3 diagnosed mental health conditions in adulthood directly relate to ACEs. The longer the individual is exposed to the ACE, the greater the impact. Some of the other things exposed to adverse childhood experiences include the ability to recognise and manage different emotions, the capacity to make and keep healthy friendships and relationships, the ability to manage behaviour in educational settings. And whilst some of those personal hardships that we talk about may not live in that list of adverse childhood experiences, they're high on our agenda at the moment. Poverty is high on the agenda. Young people are facing mental health crises, so it's important that we look and become more self-aware in terms of how we help young people to manage and regulate their behaviour in an educational setting, whether that's a short term or going to have more of an adverse childhood experience for our children and young people. We know a lot more now from neuroscience. In recent decades, we know more about how components of the limbic system within the brain are altered by early adversity and stress. Overactivation of the amygdala region in response to threat in those with experience of childhood adversity is the single most robust finding. You can read more around that from research from Mothersill and Donahoe, 2016. For these individuals, this is often associated with feeling more easily threatened or triggered in a range of situations, including situations some of us would find non-threatening. This threat hypersensitivity has been associated with a dampening of the frontal lobe's ability to modulate threat perception once the limbic system has become overactivated. A link to an ACE questionnaire can be found later in the slides, and this questionnaire was used in studies to correlate scores to thinking about later life challenges and health risk behaviours such as substance misuse, serious health condition, physical inactivity, sexual transmitted diseases, depression, and suicide attempts. Intentional integration of social and emotional learning into the curriculum can benefit all learners, but it is particularly impactful for those with ACEs. Teaching staff can incorporate activities into the curriculum that promote self-awareness, emotional regulation, and interpersonal skills, fostering a positive and supportive learning environment. Staff could empower learners with ACEs by teaching them effective coping strategies. This may include providing opportunities for mindfulness activities, teaching and modelling self-regulation techniques, or collaborating with support staff to develop personalised coping plans for individual learners. And as always, partnership working, including with families, can enhance strategies both in the home and at school or college. Teaching and support staff play a pivotal role in shaping the educational experience for learners with ACEs. By creating a safe, understanding and individualised learning environment, educators contribute significantly to the resilience and well-being of these learners. As we continue to learn more about trauma-informed practice, it's essential for all educational institutions to prioritise ongoing training and professional development, ensuring that teaching and support staff are well equipped to meet the diverse needs of learners. Through compassion, understanding and collaboration, we can create a foundation that enables every child to thrive, regardless of their past experience. I'd like us now just to listen to a short video clip that hears from an educational consultant who's been working with individual schools coping with children who have been exposed to adverse childhood experiences. So let's think about some of those persistent behavioural problems that we might see. We might see children and young people being argumentative, angry, uncooperative or irritable, having frequent outbursts, emotional demonstrations, being aggressive, provoking or bullying others, being constantly defiant, blaming others when things go wrong, telling lies, appear cruel and lack empathy, struggling to manage the boundaries and rules within a school or college, within a learning environment, and finding it difficult to maintain attention and concentration, seeking out risky experiences without thinking about the consequences, and as they get older, becoming more involved in antisocial behaviour and being at risk to those wider issues of self-harm or suicide. There are several strategies that can help us to regulate our emotions. We understand how our feelings affect how we think and how we behave. Mindfulness. Practice being present in the moment and observing emotions without judgment. This can help avoid impulsive reactions and make more informed choices. Give a name to the emotion. This can help with clarity and understanding of the emotion that's being experienced and also an understanding of any potential underlying causes. Emotion regulation techniques engage in activities that help manage stress and regulate emotions, such as deep breathing exercises, meditation or physical activity. By implementing these strategies, you can enhance emotional regulation skills and improve decision-making abilities in response to threats and opportunities. Remember, emotional regulation is a skill that can be developed and refined over time. By practicing self-awareness and utilizing effective strategies, you can gain control over emotions and make decisions that inform long-term goals and values. When we think about transference and countertransference, let's just think about what that means and what those expectations are. So, unresolved feelings from the past are expressed. Often negative feelings will transfer from the child or young person to the supporting adult. So those signs of what we might find as behaviour that challenges, those signs that we might find are inappropriate, this is the release of pain, this is the release of emotion, and we need to make sure that we understand it, respect it, manage, deal, but do so in an appropriate way. And also being mindful and self-aware of teacher countertransference, the conscious and unconscious negative or positive emotional reactions to specific situations. Things that arise within our day-to-day teaching practice and our own areas of personal conflict. And always seeing the child or the young person, the learner, first, and managing the situation in the most appropriate way, with others as appropriate. So here we have some useful links and some next steps. So a friend once, before we look at these, a friend told me that to ensure children are feeling safe, she sometimes tells them a little bit about herself first, gives them some personalised attention to check their understanding, and this helps to establish a rapport rather than just going straight in to teach. So taking some time to really get to know each individual. And she was in particular referring there to children that she was working with, autistic learners. So we have some strategies. Intervene early to take a preventative early intervention approach. The Education Endowment Foundation has produced supportive documents with behaviour in mind, for example, and there's an example of the Strengths and Difficulties questionnaire included in the links section. This can help partnership working and provide joint problem-solving exercises. Any child at risk of being excluded should be screened to understand any hidden difficulties or special educational needs. Involve parents and carers. Involve SENCO if needed. Offer support to families, listen to families as well as listening to children and young people. Refer to external services when you need to. And here on these next few slides, you will find information that's going to help you. Do feel free to offer feedback and do get in touch, and I will make sure you also have the link to the case study for ADHD. Thank you very much.